because I'm a newight, let me introduce myself the same way you were introduced about consultation. I'm Dr. Paul Oweh. I entered UI in 1982.
Same year with you.
Yeah. Now, my original hall was when I was squatted in Gucci. Squatted there. Then before, as with all doctors, we go to Alexander Brown Hall, ABH. So all doctors must pass through that hall. After 3 years, we go to the other side. So, and then I graduated in 1988. Secondly, many of our people are always fascinated wherever I go as to why I became a doctor and a lawyer. And from my previous schools, you see I've been a member of NASC, National Assembly Service Commission. And I was screened by the Senate Committee for that purpose. And the only question the entire committee asked me was to explain why I became a doctor and a lawyer. Senator Judu was the chairman then. And I told them what I'm going to tell you now, which is that primarily I'm a doctor, a product of Ibadan. But when I started medical practice in Oweh, then the faculty of law was sited close to my place of practice. I became friend to the lecturers and the various persons here. And you know, through association, you become something like peer groups. If you have a friend who smokes, you are likely going to smoke if you are very close. So my friends got me interested and I went in and studied the course. I can tell you that there are no regrets at all. So that was how I became doctor and a lawyer. And I also want to tell this body, I want to appreciate them. I know they are trying to be very time conscious because of what we agreed. I appreciate you all for doing that. I want to say that, like I see in many UI bodies, it's mostly the elderly ones. Do whatever you can to get the younger ones on board too. And from the only chapter, that's what we try to do, to get many of the younger ones should be interested so that they become supportive and the body is very good that way. So I'd like to encourage you to do things as well. And before I start, finally, I will appreciate if some of those people can occupy the front row so that we don't leave it vacant. They can do that. It will be very good. The lecture will be given about 30 to 40 minutes. You listen more to what I say and not necessarily what's in the book, because what's more important is what you take away. Not lecture as if we're going to do exam at the end of the day. I'm not a lecturer. I've also told the DBC like that, but that they should concentrate on whatever information they can take away from all that I say. Therefore, I want you to listen attentively. Thank you very much. The lecture is titled, "The team they gave to me," which is the team they are running with, is public health. And I coined a healthcare system that cares for all. Normally, the healthcare system of a country should be such that it should take care of everybody. There should be a system in the first place. And the system should be able to care for everyone. That's the meaning of healthcare system that cares for all. Now, that is the ideal situation. And so, our aim is to try to compare the data still experience with what the ideal should be. And therefore, I want to start by sincerely thanking the chairman and leadership of the University of Ibadan Alumni Association in Cash Chapter for the honor of inviting me to speak at this year's annual lecture. The theme of this year's alumni lecture is public health care. They say inclusivity, compassion, and building a nation with integrity. And I say that that's not only relevant to us now, that theme is relevant to us now, but not just that. It's relevant to all societies at all times. And this is necessarily so because I can state without fear of contradiction that health is the foundation of every thriving society. A nation can only be as strong as the health of its people. And I stand by that proclamation. Now let me start by defining some simple health concepts which are related to what we are talking about and it will help us understand more. First is health. What is health? Now the WHO, that's the World Health Organization, defines health as a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. Now, division. You know that our Nigerian population, when they talk about a healthy person, they look at the physical, as in, it's not having any ailments, no headache. But beyond that, for us, for you to be healthy, there is no physical ailment, which is no headache, no temperature, no injury, nothing. But beyond that, your mental state is extremely important. So if you are not having any physical ailment and you are depressed, you are still not healthy, isn't it? Yes. And social health is talking about relationship. So people have family relationship, they have friends, community, all manners of relationships, which are part of health. And so if you are not physically sick and you lack all these things, you may still not be healthy. So the ideal thing is to be physically, mentally, and socially healthy. The next one I'll talk about is public health. What do we understand by public health? The science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society and organization. In other words, everything that we do to keep the public healthy is public health. And public health is concerned more with the health of population rather than individuals. Some key areas of public health include disease prevention, health promotion, population health, surveillance, response, environmental health, social determinants of health like poverty, education, and so on. These are various departments that are involved in public health. Now, what do you then mean by public health system? We talk about a system. Now, the health of your public will always be as good as the system you put in place to achieve that. Again, according to the WHO, a healthcare system consists of all organizations, people, and action whose primary intent is to promote, restore, and maintain health. In other words, there is a close correlation between your health system and the public health. If your health system is, if your public health system is not good, then your public health indices and outcomes may not be good enough. Healthcare systems differ from nation to nation depending upon the level of economic development and political system in place. However, a good system is built on having trained and motivated health workers, a well-maintained infrastructure, and a reliable supply of medicines backed by adequate funding. The care system of any nation should be backed by appropriate legislation or act of parliament of that country. Every good health system should be such that the healthcare service to citizens should be available, accessible, affordable, efficient, and should be able to deliver effective and efficient service promptly to everyone. Patient satisfaction should be at the heart of such health system. In other words, when such a person comes from the health system, if you go there, take some treatment or whatever, and come back, they should be satisfied. Now, I want to take some little time out to talk on National Health Act 2014 for a special reason. This act, which was promoted by Senator Dr. Oweh, was the first major attempt at giving Nigeria a defined healthcare system. Before then, there were no defined healthcare system. You just build hospitals, you send doctors there, but it's not a system. So this act, and your Dr. Oweh, who was in the Senate, the immediate past governor, during his tenure, he promoted this act. This act, which was enacted on the 1st of October 2014, provides a legal framework for regulating, developing, and managing Nigeria's national health system, setting standards for healthcare services, and encompassing both public and private providers. This act will reflect timely provision for health insurance scheme that covers not only government workers but also non-government workers. Additionally, this act provides for establishment of national health system, rights and obligations of users, that's talking about patients, and healthcare personnel, basic healthcare provision funds, and so on. It provided for a lot of things that will operate in the system. The primary goal of this law is to ensure universal health coverage of primary health care for citizens of this country through National Health Insurance Scheme. Despite the good intentions of this law, major challenges, low enrollment and the insurance scheme, poor awareness, corruption in terms of misappropriation of funds, and so on and so forth. Now let me talk a bit about health financing. Health financing. That is, when you have a need for health services, how do you finance it? Health financing in Nigeria is of many sources, including government budgetary allocations, out-of-pocket payments, health insurance, both public and private, and donor funding. Now, usually the government's budgetary allocation for health will be inadequate to take care of all health issues. That's natural. In simple economics, you find out that your needs are usually more than your resources. Usually government budgetary allocations will be inadequate. Then also out-of-pocket payment for treatment has serious challenges of its own. Our populace are largely poor and may not likely to have adequate funds when illness or health challenges come their way. Donor funding can be unsustainable and unreliable. For example, we saw what happened or what is happening during this Trump era, where he decided to stop some activities of USAID and it's affecting HIV and all that intervention. And that leaves us with health insurance as the best pathway to health financing. By the way, when we say out-of-pocket payments, that's what is more common here in Nigeria. In other words, if individuals are sick, you go to hospitals and then you pay. Now that system, out-of-pocket payments, is full of challenges because most people, if we go by that, when they have serious problems, they don't have enough money. That's why we need a better system. Now, and that's what is driving us towards health insurance. Health insurance. So, basically what's health insurance? It's an agreement in which an insurance company agrees to pay for some or all your medical expenses in exchange for a monthly or annual premium payment. Whether the company will pay some or all of the medical expenses depends on the type of insurance you subscribe to. primary health care or comprehensive insurance. The premium for comprehensive insurance is much more than that of primary health care. However, it's good to know that the bulk of health challenges in our society today falls under the primary health care pillar. So if we can take care of our primary health issues, we will do very well already. The insurance company, which is also known as Health Maintenance Organization, will disburse premiums collected from enrollees to providers either by way of capitation or fee for service. Fee for service will often come where the health issues involved are secondary or tertiary. But for most primary situations, the providers are paid by way of capitation. Capitation means that the health insurance company will give some money to the hospitals and the enrollees will just go there, take treatment and go. That's how it is supposed to run. The biggest advantage of health insurance is that you can always access health care whenever you fall sick, whether you have money now or not. Another major advantage is that the premium paid by enrollees are usually affordable since the success of health insurance scheme is based more on large number rather than high charges for few. This concept therefore helps with the question of inclusivity and affordability. In other words, when you design the health system, you want to ensure that everybody, both the rich and the poor, are involved and that it's affordable. And what we're saying is that through health insurance scheme that you can get such a system. Now that takes us to the Delta State Contributory Health Insurance Commission, which is our own company or our own organization charged with the responsibility of ensuring that Deltans are insured. The establishment of this commission by Senator Dr. Oweh during his tenure as governor of Delta State has been a game changer in the health sector. Now, you recall I said he promoted the act I mentioned, National Health Act of 2014. And so when he became governor, he was still very much enthusiastic about it. And since he could not do so much of that, for the whole country, ensuring compliance, he decided to translate it here in the States into this body, the Delta State Contributory Health Insurance Commission. The good news is that the governor of the state right now, Right Honorable Sheriff Oweh, has not only strengthened this body, he has expanded the operations of the commission with initiatives such as Indigent Enrollee Inducement Initiative, Artisans Enrollee Inducement Initiative, where high net worth individuals adopt vulnerable citizens and cover the insurance premium. These initiatives have been helping to bridge the gap between the rich and the poor. Because the question always here is that how can we get everybody to be part of it? That's even those that do not have much money. Apart from individual enrollees and the various initiatives mentioned above, the Commission has also been running the state government equity packages of free maternal treatment and free other treatment. These equity packages, which were initiated by Governor Oweh during his tenure, is still being supported and operated by the more government of Governor Sheriff Oweh. The efforts of this current government in health sector through the Commission and other agencies have been recognized nationally. And I can tell you today that Delta is the leading health insurance operator in the country. Some other states are studying our operations in order to improve theirs. That is a fact. The Commission operates like every health insurance company or health maintenance organization, as we call them. They ensure registration of all enrollees and connect them with their providers in their localities. The government hospital under the Hospital Management Board is the largest provider in the state ensuring that large numbers of veterans access healthcare service all year round. Other government hospitals like Asaba Specialist Hospital, Oweh Teaching Hospital, and some private hospitals also offer vital access to healthcare as providers to the Commission. All government providers get their drug from the DRF, and they have their collective to do, but the political will to support it is there. Now, the premium of state government workers is deducted monthly from their salaries, and this ensures that they do not default. Corporate bodies also can also organize their staff and key into the scheme on a sustainable basis. Private individual enrollment is usually where we have some challenges, and most of our poor people populate. We often not see reason why they should regularly part with some money by way of premium in anticipation of when they will be sick. However, the initiatives mentioned earlier introduced by the government is helping to combat this. A single individual who has capacity, or an NGO or a public-related organization can easily organize a good number of indigent persons in their communities into the insurance scheme by paying their premium. So, for an individual to enroll into the scheme in the state today, it's just about 7,000 naira for the whole year. So, it's affordable. Now, what is the purpose of this scheme? What is it aiming at? What are we trying to achieve? The primary purpose of the scheme as a government policy is to ensure that every person access healthcare service whenever they are sick, even when they don't have money in their pocket. That's the key. This largely answers the question of inclusivity, because the healthcare system where only those who are well off can access it is not the best. In other words, you don't necessarily have to be a rich person to access healthcare service. Clearly, this is the pathway to go in our society. At this point, let me clarify the concept of levels of healthcare. There's what we call levels of healthcare. Because the reason why I'm bringing this position is that many people might be wondering, so this healthcare insurance, this insurance policy, does it take care of cancer? Does it take care of heart transplant? Does it take care of kidney? They will be thinking of all the big deals. But the truth is, the biggest problem in our society are the primary health issues. Those ones are special problems that require special attention. So the primary, this likely answers the question of in other ways. So at this point, let me clarify this issue of healthcare level. Healthcare generally can be provided at primary, secondary, or tertiary levels. Primary healthcare deals largely with health promotion such as diet, provision of potable water, housing, and all that aspect of health. Disease prevention such as immunization, good antenatal care, and treatment of common diseases like malaria, uncomplicated hypertension, and diabetes. All those fall into the secondary category. Secondary health care involves largely treatment of diseases in the four major fields of medicine, which are internal medicine, pediatrics, surgery, ONG, surgical and gynecology. I mentioned some of the diseases there. Those are what you commonly see at your central hospitals. The top level of healthcare is the tertiary healthcare. This often takes place in tertiary health institutions like Oweh Teaching Hospital and the various specialist hospitals that we have. Treatments are usually carried out by experts in various fields and usually having need for highly specialized equipment. They deal with most complicated and difficult cases in the land. Cases such as cancer, brain surgeries, and so on. Now, the most important point here is that the bulk of the healthcare challenges in our society are in the primary healthcare care, which can be cared for in the primary health care center and the general hospitals in our various localities. these are easily cared for. So now, the health insurance scheme, even the primary engagement with the health insurance scheme can take care of most of the commonest problems in our land. That's the point that I'm making. Now, so the contributory health scheme has been running this for some time now, and trying to ensure that large number of deltas key into this scheme and then they are able to access it. However, they do have some challenges as they are carrying on with this assignment, and I'll just mention a few of them. For example, we need more people to understand and key into the scheme, especially our rural and poor folks. It's a better pathway to sustainable healthcare access for them if only they know and understand. There is therefore need for more advocacy on this. In other words, you need to understand that there's something like this, then you try to key into it. Many of our people may not even know about what I'm talking about. And in lectures like this, the advocacy can carry on, from our people here. I've already talked about how individuals and NGOs with capacity can help. A good number of persons in this audience fall into the categories of persons who can enroll other persons, and you therefore clearly can help. So I call on you to join us in this struggle. And particularly the council chairman representative. The council chairman can register almost the whole community. With 7,000 naira, you can register such a large number. For example, a group of mechanics, a group of traders, you count them with, if you get 100,000 people, that's just 700,000 for 1 year. That's doable. When you pay that, they can go to their providers and receive at least most primary health care all year round. It's a good one. We also have the question of shortage of manpower and health infrastructure. This is usually what manifests as overcrowding of patients at the outpatient department and wards, especially at the urban facilities like Central Wari, Ughelli, and so on, including Airport. As a result, patients may often spend much time before seeing a doctor for consultation and treatment. This challenge is often at the root of many patients' dissatisfaction with our services. I said that patient satisfaction should be at the root of all health systems. But we also know that the number of our patients, they are dissatisfied, then they go and come. And these are some of the reasons. And then we try to do something about the challenges. The above scenario can be improved upon and is being improved upon by expansion of our facilities and recruitment of more staff. The constant migration of our highly qualified health personnel to foreign land is a phenomenon that is known as what? Who we all know about Japan. It's a major problem. DVC, you are involved in training highly qualified personnel in all fields. Tell them as you train them that they should use their knowledge and skills to help our people back home, and that conditions of service will do everything you can to improve on it. So that's a major problem, has contributed greatly to this problem. Fortunately for us, at the Hospitals Management Board, we have standing approval from the previous government. This government has also sustained the approval. Is that not correct? To replace without further approval any government doctors and nurses who leave our services. This policy has helped in no small measure in ensuring that our hospitals continue to run despite the massive regular migration to foreign lands or greener pastures. So even as I speak to you, if you know a consultant in any field and you want him in our system right now, you'll be engaged today. So it's like even doctors, regular doctors, you don't find them, they are just looking for help from migration. So it's a major problem. Also, the state government is getting it right by carrying out renovation and expansion of about 150 primary health care centers across the state. That's the current program that announced to this audience that the state government recently won an award from the Gates Foundation, a national primary health care development agency, for its efforts in the primary health care field. We won that